So this is our Jupiter ICU ventilator. This ventilator comes along with the compressor, and this is the compressor unit, and the ventilator is mounted on the compressor unit itself. So this is a pneumatically driven and electronically controlled ventilator with a 3.4 inches of display, and this ventilator has got built-in blender in this, so you can enrich the oxygen and you can give the FiO2 value to the patient between 21 to 100%. So now I am explaining you about the backside of this ventilator. This ventilator has got two inputs. One is for oxygen. This is directly connected to the central pipeline system of the hospital, or you can connect it to the cylinder with the help of a MOX regulator. And this is the black pipeline for air, which is connected to the compressor over here like this. And this is the mains AC power supply. This is the power cord connector over here, which is connected to the mains AC 220 volts of the hospital. As it is mentioned earlier also that it has got built-in blender, so this ventilator you can run with between 21% to 100%. So this is the O2 concentration knob over here. So if you want to give between 21% to 100% oxygen to the patient, the FiO2 value can be increased or decreased with the help of this knob, and the oxygen enrichment can be done. This ventilator runs with the single limb circuit, which is connected on the side of this ventilator over here. This is the patient tubing, and we have given two lines over here. One is P proximal and one is exhalation valve line. So this P proximal line is used for measuring the airway pressure of the patient, and this expiratory valve will be controlling the expiration valve, which is on the patient's end of the circuit, patient tubing over here. So this is the expiratory valve. So when the patient is expiring, all the gases will be exhaled in the atmosphere from this expiratory valve, and this expiratory valve opening and closing will be decided by the ventilator through this expiratory line over here. Now coming on to the controls of this ventilator has got this on-off knob over here. So for turning on the ventilator, you have to move the knob up to the on position like this, and then you get a screen display, standby display over here. So for doing the several settings of the parameters, you have to press this settings button over here. So whenever the corresponding parameter gets highlighted, you can change this parameter. You can increase or decrease with the help of this increase and decrease buttons over here like this. So if I want to select the target volume as 700 ml right now, so I have selected it at 700 ml, and for confirming this I have to press and hold this confirm key for 2 seconds. So now this